Hey guys, this is a part-time economist, and today we are talking about VA healthcare. Now, if you remember when you joined the military, one of the big selling points was the free healthcare, right? And as you leave the military, that's one of the biggest concerns that a lot of people have. What about my healthcare? What am I going to do? And the VA healthcare is something that's available to you as a veteran, and you do have to follow an application process. There's some requirements for getting in, but it's well worth your time to at least consider it. So stick with me through this video, and I'm going to show you my experiences going through the process, as well as some information from the VA website that might be able to help you in your situation. Now, the first thing to understand is that the VA has limited funding. So for the veterans that apply, they classify them into different priority groups. And this makes sense intuitively, because a veteran that has no disability and is making hundreds of thousands of dollars doesn't need free healthcare as much as a veteran that's 100% disabled and can't work. So as we go through these priority groups, they have different requirements to get into different groups, basically. So priority group 8 is the lowest priority for VA healthcare. This doesn't mean that you're not going to get accepted. It just means that you are the lowest priority if they don't have funding to accept everyone. So priority group 8 is veterans with gross household income above the VA limits. So if you make above a certain amount and you don't have any disabilities, you are in this lowest group. Group 7 is no disabilities, but you don't make a lot of money. Now, Group 6, I say again, is absolutely key. If you have any kind of disability, even 0%, right? Even if you have 0% for tinnitus, 0% for knee pain, it doesn't matter. You are going to be put in priority group 6. Additionally, even if you have no disability at all, but you served in a theater of combat operations after November 1998, you are eligible for 5 years after your date of discharge for VA care. Again, you do not have to have a disability for this. Simply serving in the theater of combat operations for 5 years after, you have access to the VA healthcare. And this is key because a lot of people don't understand this. When I got out, I had served in a theater of combat operations, so I applied and I was accepted into priority group 6, even without any disabilities, just simply because you meet these requirements. So if you're getting out of the military, if you've been deployed, do this. Apply for this because it's something that you're always going to have. The VA healthcare, you don't know what's going to happen in 5 years, what your job's going to be like or whatever. And even if you don't go to the VA, this is insurance. This is something that's going to be there for you if you need it. You're already going to be enrolled. Just do it, okay? Now, as we move up to the other priority groups, now we start getting into more and more focus on the disabilities themselves. So group 5 is non-service connected veterans and non-consequential service connected veterans rated 0% disabled with annual income limits below. So remember, group 6 was 0% disability, group 5 is 0% disability and income below a certain amount. Group 4 are catastrophically disabled. Group 3, now here's where we start getting into more and more, like I said, the disability rating. So here we're looking at 1, veterans that are disabled service connected with 10 to 20%. So again, 10 to 20%. That's why I encourage everyone, even the VA tells you, when you get out of the military, file a claim. And there's a few reasons for this. 1, you don't know how your injury is going to progress, right? So let's say you have knee pain. File your claim for 2 reasons. The first reason, you may be eligible to receive compensation for that knee pain. But additionally, if you get rated 10%, then this also puts you in a higher priority group for VA healthcare. So 2 separate systems, but doing the application for that VA disability also helps you to get the VA healthcare. So when the VA representative comes and you're doing your separation process, definitely talk to them. Apply for everything that you are eligible for. These programs are here, they're in place to help you. Now, as we move up, we have, still in priority group 3, veterans whose discharge was for a disability that was incurred or aggravated in the line of duty. So any of you that are getting med board, if you're getting chaptered out of the Army for medical reasons, look at this. You could be eligible for priority group 3. Priority group 2 is veterans with service-connected disabilities of 30 to 40%. Priority group 1 is composed of 2 components. 1, anyone that's 50% or more disabled, or veterans determined by the VA to be unemployable due to service-connected conditions. Now, what do these priority groups mean and why does it matter? Priority groups are important for 2 reasons. 1, it determines your access to care. So the VA only enrolls so many veterans per cycle. I don't know if it's yearly or monthly or quarterly, I don't know. But they only are able to enroll so many people, right? So the priority for new enrollment is going to go to the priority groups that are highest. So the 1s, 2s, 3s, 4s, right? So number 1, it determines your eligibility for getting into the VA. Once you actually get accepted into the VA, it also determines your fees for care. And what I mean by this is that there are different co-pays associated with treatment. I don't know if I should say the higher or the lower, but if you're a priority group 1, 2, or 3, your co-pays are going to be a lot lower. That's 4, 5, 6, 7, and 8, right? So the lower numerical value that your priority group is, the less you're going to pay for co-pays and everything like that. And I put a link if you guys want to check out the co-pays and everything like that, depending on priority groups. Now, how does the VA healthcare actually work? This is a good question. And for those of you that were in the military, you know that you went to your PA, your sick call basically, right? You would go there and they were kind of like your primary care physician. If it was something simple, if you had the flu, if you had some kind of infection, they would give you whatever you needed right there. And if they didn't, they would send you to some kind of like specialty care clinic. Same thing for the VA. The VA works on a community-based outpatient clinic. So in my state, I think they have maybe 6 of these community-based outpatient clinics. So this is like your primary care provider. You go to them for everything. If you need specialty care, they refer you somewhere else for that. When you do your orientation, you will be assigned to a patient-aligned care team. This means that every time you go in, you're going to see the same receptionist, the same nurse, and the same nurse practitioner as your primary care physician. So it's all about developing that relationship. They kind of know your medical history. You see the same people, so you're not having to tell your same story over and over and over. Like I said, the referrals, the specialty care, that will be coordinated by your primary care physician. How do you apply? You can apply online, in person, mail, and telephone. Again, I've put the link here for you. And now I just want to talk specifically what to expect. So you've decided that this is a good idea. You decided that you want to apply. The first thing is this is much, much, much quicker than your VA disability claim. I even started my VA disability claim with the benefits delivery at discharge, and it still took several months for that to finally, everything to go out for that. The VA healthcare, I think I was accepted in about 2 weeks. It was very, very fast. When you were accepted, there's going to be 2 things that you will get right away. The first is your Veterans Health Handbook, and inside this it's going to tell you all the different things that you can be eligible for. It's going to tell you your copay rates. It's going to tell you everything like that. In addition to this, you are going to receive a card for care that you get that's not at a VA facility. I think it's called the Veterans Choice Program. And then once you actually go to your orientation, you'll receive your Veterans Health Identification Card. This, 1, identifies you as a veteran, but 2, it's the way that you check into all of your appointments. Now, in summary, the VA healthcare, it's a resource. It's there for you as a veteran. Most veterans, especially those, even if you didn't get a disability, most veterans will be eligible at least for some kind of VA care. Even if you don't think you want to use it, I strongly encourage you to apply, because maybe you don't need it for knee pain or back pain, but maybe you can go there for your free flu shot or something like that. You know, it's always good to have a little bit of insurance. It's glad to know that if something happens, you will have that care there for you. So any questions, just post them here. I'll do my best to answer them. I hope the video has been useful, and I'll see you next time.